So good evening, everyone. So today, this session is mainly for MBBS first year. I hope I'm audible and visible. Everything is okay. Okay. So first of all, I know that I'm addressing MBBS first year student. So first of all, I want to congratulate you all that you have chosen a career that is medical career, and throughout your life you will cherish because it is one of the best career you can have. And the physiology as a subject is a like a glue factor. It is connecting a lot of subject together. I mean, if you study pharma, patho, medicine, anywhere, any subject, it will always begin with the physiology. So physiology is that interesting that every subject will begin with physiology, anatomy, and then it can be like gynae, ops, orthopedic, surgery, whatever. But physiology is the main concept in our body is physiology. And the thing is that this is basically a guidance session. I have taken a topic, like integrated topic, pineal gland. So in NMC curriculum, there are a few topics which are integrated and they are coming every year in your examination, like temperature regulation, biological clock. So just by taking one example of biological clock, pineal gland, you will be able to understand how you can integrate a lot of other topics as well. Okay. So for example, I'm talking about the pineal gland. So pineal gland have mainly two functions. One is biological clock. So this question can come separately as a biological clock also. What is biological clock? What is suprachiasmatic nucleus? And how pineal gland is helping suprachiasmatic nucleus to maintain your biological clock. And right now, it is trending topic everywhere in the world that we should follow the circadian pattern. And you, as a student, also as a medical student, if you want to increase your output, your performance, you have to follow the circadian pattern. So, what is the circadian pattern everyone is talking about? So what is the basic physiology of that? Okay, so there are two types of clues. One is called as external clue, other is called as internal clue. So when this sunlight is called as external clue. When sunlight, they are falling on your eyes. You know, eyes, we have retina. In the retina, there are plenty of cells like rod, cones, horizontal. But there is a ganglion cell. In the ganglion cell of the retina, there is a pigment called as melanopsin. It's a really very interesting topic I'm telling you, not for your physiology, but for your day-to-day life as well. You should know because as you enter your MBBS curriculum, people start asking you what is the physiology of circadian and all. So you need to understand whenever sunlight falls on your retina, the ganglion cell, rods and cones are for vision. I'm telling about the circadian. Ganglion cell actually have a pigment called as melanopsin. It is the pigment called as melanopsin, and this melanopsin will sense the sunlight. And through optic nerve, it reaches optic chiasma. And above the optic chiasma, there is a nucleus in the hypothalamus, and that is called as suprachiasmatic nucleus. That is called as suprachiasmatic nucleus. The suprachiasmatic nucleus, you must have read in your NEET PG also, it is a biological clock. It is acting like a biological clock. So when you are getting the sunlight, it will suppress the pineal gland because pineal gland is mainly working in darkness. It will release melatonin in darkness. That is why melatonin is called as hormone of darkness. So when sunlight is falling on the ganglion cell, sensed by optic nerve, then by suprachiasmatic nucleus, it is going to inhibit pineal gland. Okay, so there is no melatonin. There is no melatonin in the daytime because it is a hormone of darkness, isn't it? So this is telling each and every cell of your body that what is the exact time. You can see your watch, okay, this is 6:30 p.m., whatever is the time. But how your cell, because your cells are also having exact orientation of that time. Okay, exact orientation because some hormones will be maximum in the morning, some hormones will be maximum in the evening. So how they know the rhythm? This is the way they are knowing the time. So this is about the sunlight when sunlight is falling. Okay. One more thing I would like to say. When sunlight is falling on your eyes, Raphe nucleus is also activated, which releases serotonin. So when you are exposing your body, your eyes to the sunlight, you have serotonin, the happiness hormone. So when you are in the daytime, you are feeling happy. It is because of the serotonin. And if you are always inside the curtain in your room, you are not exposed to the sun, it is very bad. You can feel the depression. It is called a seasonal affective disorder. So anyhow, so when you are involved in the day-to-day activities, and you are not inside the indoor and you are going outside, you will be exposed to the sun, and that is going to suppress the pineal gland. And now, after the sunset, sunlight will be gone, and now pineal gland will be activated, and now it releases melatonin. So melatonin, serotonin, they are actually amino acid derivative. They are amino acid derivative. Melatonin is a hormone of darkness. That is why when we are going to US, the flight will be for 12 hours. And after 12 hours, what will happen? Again, there will be day. So your set point will be disturbed and they start having headache. In that time, we are giving them melatonin. So suprachiasmatic nucleus, in sync with the ganglion cell, along with the pineal gland, is activating this biological clock. And this is how our body knows exact time. Is this clear? This is how our body is knowing what is the exact time. And in the night, we have more of the melatonin, hormone of darkness. It is helping in sleeping also. So we can have a beautiful NREM sleep, will be fresh in the morning if it is helped by melatonin. So throughout the day you will be active, throughout the night you will be feel sleepy. So this is a beautiful circadian pattern. One more very important thing I would like to say, it is preventing precocious puberty. Nowadays there are so many cases of precocious puberty. What is the main cause? Actually, do you know gonadotropin releasing hormone activate FSH and LH? Yes, you know about the basics. GnRH activates FSH and LH. When? When release is pulsatile or when release is continuous? What do you think? Only when release is pulsatile, it will activate FSH and LH. And when release is continuous, it will inhibit FSH and LH. So up to a certain age of puberty, GnRH release is actually continuous. So when GnRH release is continuous, puberty will only come after a certain time. So who is preventing this pulsatile secretion of GnRH? Who is preventing this precocious puberty? One is melatonin, other is GABA. So melatonin is again very important for children also to prevent precocious puberty. It should be at the right time. Should not be early, should not be late. Late puberty or the early puberty, both are dangerous. So again, melatonin is playing a very important role because after a certain age, there is a peptide called as KISS peptide that will activate GPR and that will cause pulsatile release of GnRH, activating FSH and LH, and then it will cause puberty. So this is how puberty will come. So pineal gland is of course obeying the biological rhythm, but biological rhythm is controlling almost every hormone. Like, for example, cortisol, CRH, ACTH, these all are obeying the circadian pattern. They are maximum when you wake up in the morning and they are minimum at the night around 12:15 a.m. But they are maximum when you wake up in the morning, it is approximately 8:15 a.m. when you wake up in the morning. Because when you wake up in the morning, you are supposed to go out and run, do exercise, do work. Okay, our body are they are modified like that only, na? So pineal gland is a wonderful gland. Like that, there are plenty of topic. Temperature regulation. Someday I will take about the temperature regulation. But today I have just taken pineal gland to make you aware that this is really very interesting. And this live session is only to instill some interest in your subject because you are in first year. And in first year, people are bored easily. They are bored easily. They don't know why we are studying RMP, why we are studying action potential, why the cell membrane, until they know the clinical application of that. Because you want to become doctor, of course. You have joined MBBS to become a doctor only, na? So this is very important that for everything, for example, you are studying transport across the cell membrane. Why we are studying sodium potassium pump? Because every cells are decorated by the pump. Until you know about the pump, how can you know that thyroxine hormone activates this pump? Okay. So this was a brief live session on the pineal gland. If you have anything to ask, you can ask. Else we can continue other day also. So let me summarize the bullet point. Pineal gland is working when there is darkness. When there is a light, light falls on the ganglion cell, activates the prokaryotic nucleus, and they will suppress pineal gland. And this is how every cell will know it is day. In the night time, there will be pineal gland activation, releasing melatonin, and this melatonin is giving you the sense of that there is a darkness, there is a night, we should sleep. And this is how the lot of parameters like blood pressure, your blood glucose, your cortisol level, they all are regulated according to the circadian pattern. Okay. You can, I mean, comment, or if you have any doubt regarding that, you can ask in the comment section. And believe me, you are going to enjoy physiology once you have proper orientation of that. If you go to see DocTutorials app, there are plenty of videos. You can watch there. They all are having a lot of animation just to bring some interest in that those topic. For example, in the kidney countercurrent mechanism, it cannot be understood without animation and all. So we have used proper animation with proper understanding. And nowadays, the question what they are asking, they all are clinical questions. They are mostly clinical questions. Okay. So they will give you some clinical case like myasthenia gravis or Lambert-Eaton syndrome like that, and then they will ask you what is the diagnosis, what is the physiological basis of that. So once you start studying physiology with the standard textbook like Guyton, Gannon, with the help of these videos, they are going to help you a lot. Okay. This was a short session. This was an ultra short session only. We are having frequent these types of session just to instill some interest in the subject. And if you want to take me any class on any topic, in that case, you can just message on the DocTutorials WhatsApp group. We'll try to take those live classes as well. Okay then, thanks. Thanks a lot. Happy studying. All the best.